turning, that rotation component. So let's get started. We're going to start with beginners and then intermediate and advanced. So again, like always, our 20 to 30 second timer. And once you get comfortable, right, with that up to 30 seconds, then you're ready to increase the load. All right, so let's get to it. The first one is the good old rotation. Most people go straight for the well-known wind chill. I like to start my very beginners, or the people that are having back issues or coming back from back injury, to where your feet are underneath you. The ball is away from your face, more over your chest and stomach. And then, roll your ankles, then your knee, then your hips, okay? And then the ball is going to go in the opposite direction. So it's going to look like this. I'm going to start the timer too. So we're going to go here to there. And this is the beginner. And we're looking for that rotation. Now, this is perfect for people that are returning back, or they might have too much girth in the midsection for them to actually lift their legs. Okay. Now, if you're a beginner, but you're not that limited because of injury or back pain, what I will suggest is the next one. So I will say beginner B, right? So we're going to cross your ankle, and then you're going to aim towards your shoulder as you rotate. So it's going to be in this fashion and this fashion versus just right to left. So it's more of an angle upward. Okay. And the whole movement is, again, the same. The ball goes opposite direction to the knees or the lower body. And if you recall, from a day or two ago, we were going over the alignment, how the muscles run. The rotational muscles are more in a slanted diagonal pattern, and that's why you see a lot of the patterns that we've been doing are in that fashion. And we do some cross rotation because that's part of what the thoracic spine does, right? All right, so that's the beginner. The intermediate is similar, right? Except now we're gonna go side to side, again, about that 30-degree angle, 40-degree angle here. And think of getting your feet on the outside of the ball, so here to there instead of right to left. So again, you're going this way and that way, right? And then once you're ready, you can add the ball to go the opposite direction, which is different. Oh, forgot to start the timer. Different than their good old back in the 80s Russian twist or wind chill. Sorry, the wind chill. Okay. So again, you're going 30, 40 degrees that way, almost kind of like you're going to roll back, but there's that rotational part, right? Opposite direction. Good. And remember, at the end of the day, you always want to close that gap between the last rib and that pelvic bone. That's what really engages your rectus abdominis, your midsection, and then the obliques are coming around here. Now for the advanced one, it's going to be similar to the intermediate, but now we're going to go fully on that angle. So if you were to have your arms extended to the side, think of reaching towards your hands with your shoes, with your feet, okay? So it looks like this for the advanced level. So we're gonna go that way and that way. See how much further out you go, and you still got that rotation. Now, if you notice, with all of them, I had my hips right here bend or flex, we call it in therapy. And the reason for that is because I want to minimize the use of the hip flexors or the quads. I really want to close that gap here, and then with the movement, resort to these guys, to the obliques. Okay, so that's exercise number one. Exercise number two is another one favorite because it's comfortable. It doesn't really put so much pressure on the spine, and it's a great way to kind of fall into your cool down motion if you're one of those people that like to do your abdominal core work at the end. So first thing, you get to lay on your side like a baby, like this.